Welcome, everybody, and today's episode is we're talking about the so-called male menopause, which is the loss of testosterone or decline in testosterone as all men reach a certain age, and which can manifest itself in very severe and significant adverse effects on erectile function, on cardiovascular exercise capacity, and perhaps most importantly, your general mood and zip for life. So we hope that by the end of this, you'll have much more information about this so-called male menopause and feel confident to go and get yourself tested should you experience any of the symptoms.
Hello everyone and welcome to the Wealth of Health podcast. My name is Ahmed, I'm the CEO of Echelon Health, and with me as always is Dr. Paul Jenkins, Medical Director, Consultant Physician and Endocrinologist. Paul.
Hello and welcome.
Today's topic is male menopause. Paul, I did not know this existed before I did my research about this episode. Is there's something called male menopause?
It absolutely is, Ahmed. I'll call it the menopause.
The menopause, I know, I want to coin that term, the menopause.
It's all good. There are the more scientific terms. As an endocrinologist, we might call it late onset hypogonadism or
I think we'll go with menopause.
menopause. It tells you what it is, and it's a very real issue, and it affects people very, with it can have very serious adverse effects. So it needs to be, awareness needs to be raised more about it.
So I know menopause. Women go through it. Every single woman is going to go through it. But what is male menopause? What happens?
Okay, well, the female menopause is when the ovaries stop producing estrogen.
Yes.
And it goes generally in the mid-40s onwards, late 50s. Yes, and there's quite a sudden and rapid decrease in the production of estrogen by the ovaries.
Right.
Conversely, in men, yes, from our 30s onwards, there is a little trickle down of testosterone levels each year. And each year, the production of testosterone by the testes reduces by 1.5%.
Okay.
So that means that by men in their 50s, around 15% of us will have low testosterone levels. And then that in itself can result in significant symptoms.
What can you give me an example of some of the symptoms?
Well, I think they're really threefold. Three areas that you need to consider when you're discussing with a patient whether they have the menopause or low testosterone level.
Yes.
So the first and the most cliched one is that of sex function.
Right.
So you notice reduction in the sex drive, the libido. The erections are not quite as strong as they used to be. Difficulty or reduced frequency of experiencing early morning erections. So as we wake, often have an erection, that's a physiological sign of testosterone sufficiency.
Right.
Yes. So those are really the three, of the sex function. Then you have changes in the body shape. So reduced musculature. Yes. So you might find that in the gym, you're not able to perform the exercise as much as you can, or not lifting the weights. You get increase in visceral fat. So in men, it's very common as you get older, central fat on the outside. So that occurs. You get changes in mood. So it's low mood and increased anxiety, variable that, and you get poor sleep. So those are sort of the other aspects on the body, yes? And then the third area, and indeed the one which I find is the most sensitive in men, is just the loss of zip. You lost your mojo. You're just not firing on all cylinders. And life just becomes a bit of a drag, and you just get this sort of grey blanket sensation of, life's a bit of an effort.
So this is all because of the reduction in testosterone levels, or is there something else involved?
No, it's the low testosterone, the gradual decline in testosterone. And clearly other men are affected differently with different hormone levels. Some men start with a very high level, the fall is less. Other men start with a lower level, the fall is more dramatic.
Okay, and it also, you said, affects your mood.
Yes. So it's common to have a lower mood with low testosterone and or increased anxiety. Yes, some people become more anxious over things. Some men report they're slightly more irritable. Now, clearly those, your wife, my wife might say, well, you're irritable, low mood, grumpy,
I mean,
or
that's
so and so.
fantastic. I can hang every problem on,
Yeah, exactly.
on,
Blame
this-
it now on the
on male
hormones.
menopause
Yeah.
now. It's fantastic.
Yeah.
So the levels of testosterone, do they keep dropping until what? They're completely depleted by the age of 70 or 80, or do they stop and plateau?
No. Well, I mean, everybody is different, but they can continue to trickle down. It's just whether you are affected by them. And this is the grey area of when you would institute treatment, to try and replace that. Or what I would say is whether you institute a pragmatic trial of testosterone supplementation to see if we can make you feel better. And that's what, in my practice as an endocrinologist, clearly I see this an awful lot.
Right.
I'm a great fan in pragmatic trials, because you've come to me saying I've got some symptoms, or it comes out on questioning. Yes, you want help with those symptoms. I want to see if, and if your testosterone is frankly low, or even in the low normal range, is whether supplanting it, will make you feel better.
Right. And I think when you start to speak about this, the first thing that came to my mind is, I bet 90% of men would lie in their interview with the doctor about these things. Sex drive.
Absolutely.
All of that.
Oh, no, I get that all the time. No, nothing wrong. No issue with my libido. No, I'm still there.
Yeah.
You have to tease a little further.
I'm still, He-Man.
Exactly.
So how do you get over something like this, or promote honesty or openness when it comes to us?
Well, I think by speaking about it more openly, honestly, telling men that it's extremely common as we get older. Yes. Hopefully, if you correlate it with their blood tests, yes, you can say, well, there's a reason for this, or it's okay to talk about it. Now, clearly, if somebody's blood testosterone level is in the high normal range, then it's very unlikely that that's responsible for the symptoms. So you've got to look for a different level. Having said, and just as a quick caveat before I forget, your testosterone production of testosterone varies during the day. So you must always measure it first thing in the morning where it's highest.
This is another fascinating piece of information.
Commonly, men are referred to me with hypogonadism or low testosterone, and then you say, well, with blood tests, you say, when did you have those blood tests done? They say, oh, the afternoon tea time. Well, your levels will always be low. So straight away, that's the most likely cause for it. So you re-measure it at 9 a.m., which is the standard time, will be highest, and then the normal
Get an
range.
accurate reading.
Yeah.
Okay. So anything other than TRT or testosterone replacement therapy, because while some people don't mind it at all, and some people, this word, they get an allergic reaction from when people tell them you have to take TRT, or are there any lifestyle changes that could help with that? Are there any non-pharmaceutical solutions?
Not really. No, exercise doesn't increase testosterone. No,
really, because there's a theory.
It does not. I looked at this when I was a younger research student. I wrote a lot on this area, and I'm very keen on exercise and endocrinology and studying all aspects of it. No, it doesn't do anything to testosterone production. It does to growth hormone production, which is another hormone, one of the most potent stimulus to growth hormone production, can increase prolactin secretion, another hormone, but not really testosterone.
But not really testosterone.
No.
Can help with the mood, though.
Oh yeah, exercise is fantastic, but that's a release of central endorphins. That's why the people get addicted to exercise.
Yes, and loss of body mass can be, counterbalanced with weightlifting.
Yes. Yeah.
So is this part of the aging process or part of the male menopause, the loss of muscle mass over the years? Both.
Both. But part of the aging process is due to loss of testosterone, reduced testosterone. But it was also, as we get older, our body makes less growth hormone. So it's the combination of growth hormone and low testosterone that causes what we call sarcopenia, which is the loss of muscle mass, and therefore the loss of strength, and therefore the increased fragility and frailty as you get older, which is one of the biggest causes of
falls, breaking hips, and
serious ill health, stroke, early death.
Right. Yeah. So the difference between menopause and male menopause is that the female menopause is sudden and it's a rapid decline,
Correct.
and the male one is steady and it's over a longer period of time.
Correct.
When would men start to notice, or when does this typically happen? At what age?
Well, it can be probably similar age, 50 plus.
Okay.
It can be younger than that, like female menopause, can be, in the 40s.
Perimenopause.
But if you are having symptoms of this, and to be honest with yourself,
yes,
and sometimes with your partner, and say, am I more grumpy? Yes. Am I more irritable? Yes. And then saying sometimes it's the partners who quite often nudge and say, well, look, the erectile functions, it's not as good as it used to be. Do you want to investigate, see if there's a cause for it? Yes, you're not full of the same vim and vigor as you used to. You don't have the same zest for life. You don't want to get up and do things with me or the family.
But a lot of people would just attribute that they're getting a bit older.
Yeah, exactly.
And that's part of life.
Accept that, but I would counter that. That's a diagnosis of exclusion.
Right.
Yes, you're just assuming it's just getting older, but we don't know that until you've had other causes which can be very easily treated, excluded.
Is that something you can talk to your NHS GP about?
You should be able to, yeah. And they should be able to measure a testosterone level in the morning, yeah.
And can you get a prescription of TRT?
Yes.
Oh, you can?
If you're frankly low, right. Now the grey area is that if your levels are in the low normal, whether or not your NHS GP would be comfortable in prescribing it. Yeah. But I have a very low threshold for prescribing in the low normal. It's someone who's got symptoms. Because it's pragmatically, it's the only way you're going to know, is this at all responsible for their symptoms? Get the levels up into the high normal. And usually patients, they'll come back to me after 2-3 months. And I'll say, with blood tests showing it's in the high normal, how do you feel? And I've had lots of patients one the other day, completely transformed, doc. Thank you so much. Got all my vim and vigor back. I'm enjoying life again. The wife's happier because I'm able to go out and do more. I feel like my old self. So yeah, he wants to continue on it. Yes. Other patients say, well, no, it's made no difference really. It's just the same.
And is it a fact that it makes no difference with some people?
Yes. Yeah, because then it's clearly that's not the cause of your symptoms. So they say, well, then there's no point you carrying on with the testosterone.
Even though they have a lower testosterone levels.
Yeah, it depends whether it's a low normal or frankly low.
Right.
Yeah, but if it's in the low normal range, then you say, well, that's just, that's you. Those are the levels that are for you, but it's not causing your symptoms.
What about the potential risk of using TRT on developing testicular cancer or prostate cancer?
Okay, well then you're getting onto the safety aspects.
Yes.
We know that these are very valid issues. I think the number of points there. The first is that we're talking about physiological dose replacement. So giving you enough testosterone to get your levels into the normal range, but the upper quartile, the upper bit of the normal range. Yes, this is not about androgenic, anabolic.
We're not applying for Mr. Olympia.
Correct. Yeah. Or getting pharmacological dose where the side effects are much worse. Okay, so that's the first caveat. The second caveat is there are certain conditions which would probably preclude you from having testosterone replacement therapy. The first is cancer of the prostate, known cancer of the prostate.
Within the family?
No, within you.
Oh, okay. So if someone had prostate cancer...
Although the guidelines for that are changing, but in essence is a little bit like women with breast cancer.
Right.
That's a hormone-sensitive cancer. Prostate cancer is a male hormone-sensitive cancer. So that would be another contraindication. The third one is if your blood is too thick. So you have just something called polycythemia. Your body makes too much red blood cells because testosterone also stimulates that. And so your blood can even thicker, and that increases your risk of stroke.
Blood clotting.
Yeah.
Right.
So those are really it. Some evidence about, if you have severe obstructive sleep apnea, that could be worsened with prostate, with testosterone treatment. Yeah.
Okay.
But excluding that, then the safety measures of being on testosterone, generally it's very safe. It does not cause prostate cancer. Okay. But if you have a prostate cancer already, it can make it grow more quickly.
What if I have a strong family history?
No, I would say there's not a contraindication to it if you are symptomatic, but again, it's a risk balance. Yes, but I would also then caveat that you should have regular screening of your prostate anyway, with a strong family history, because there
Above
is a
a certain
genetic
age.
predisposition. So,
Right. So what you're telling me is male menopause happens gradually. It happens because there's the production of testosterone is less and less, but by 1%, 1.5
1.5% a
every year
year. Yep.
since the age of 30,
Mid-30s.
mid 30s. And so it could lead to many symptoms, irritability, lack of sex drive, erectile dysfunction, all of that. But that can all be potentially reversed if you get your testosterone levels up back to normal levels.
Yeah, and back to normal or up to the upper part of the normal range. Yes.
Why aren't more men doing that? I mean, for me, this seems to be, the biggest thing for men after a certain age is, oh, I'm just not as strong as before. As you said, there's no vigor. But so why aren't more men seeking that solution?
Well, firstly, they are,
They
but
are.
not as many as they should. It's much
That's what I mean.
more widespread. Knowledge of it is becoming more widespread, more common. Yes, so more and more men are aware of it. They need to be careful who they see, because there's a lot of clinics offering TRT without necessarily the full knowledge behind it or inappropriate dosing of
Is
it.
it doctors administering it or
Both, yes,
or non-doctor?
non-doctors.
Can a non-doctor prescribe TRT?
There's a lot on the sub, for instance, in the gym world. So
right.
you can get it, yeah. But so you need to be careful who you are seeing, but be properly tested, and then if appropriate, have a trial of treatment. Yeah. And the treatment of it, there's a number. You can have either gels, you can have injections every 1 or 2 weeks, you can have an injection every 2 to 3 months. You can have buccal. We used to put a buccal, just in the gum.
Right.
Or there's tablets. The tablets are not used now because that's an increased risk of liver cancer, because they're metabolized through the liver first, the so-called first pass effect.
Right.
So the liver doesn't like them. So really the ones are either injections or gels.
Okay.
I like gels to start with because the effect of them is more rapid, and you can titrate, which is adjust the dose of them more easily. And it's clear alcoholic gel that you put onto, depending how hairy you are, but 2-3 pumps usually rub on the chest after you've showered in the morning.
And that's it.
Wait a couple of minutes, it dries, it's absorbed, done. You can have the injections, but then you've got the issue of needles and safe disposal of the needles. And if it's every 1 or 2 weeks, that's a bit of a hassle. Who's actually going to inject? Because not everybody wants to self-inject. And then there's the long-acting one that, in the end, many patients prefer once they've been established on the gel, which is sort of every 2 or 3 months. But again, that's quite a big injection.
Yeah.
So you've got to have somebody who's
for me, it should always be done by a doctor.
Well, it's a doctor or the nurse. Yes.
Yes, a doctor or a nurse, like by a medical professional, not
some people
by a gym bro.
Their wife. No, they can't get your wife to do it if you trust her.
I wouldn't let my wife stab me with a needle. Okay. Well, any other advice in terms of the non-medical side? I'll go back to the lifestyle changes.
No, I mean, this can help. And just going back, a lot of patients, around 50% of patients with diabetes, newly diagnosed diabetes in the 50s, had hypogonadism, at low testosterone level. So for reasons we don't quite know, there's a definite interplay with that. Restoring testosterone level to normal dramatically reduces the risk or the incidence of diabetes.
That's incredible.
So that's the first thing. If you have newly diagnosed diabetes, you should certainly have your testosterone level checked. Yep.
Okay.
But it's slight chicken and egg, because if you are feeling better in yourself because of your testosterone level, you've got more energy, more zip, or get up and go, you're going to make more positive, you're being more proactive in life.
Yes.
And then patients are much more inclined to undertake the regular exercise, because it all becomes synergistic. They feel even better doing exercise.
Of course.
Doing the weight.
So it's a viral positive cycle.
Exactly. So that's adds to the positive effects of it.
Okay. Well, that was fascinating. Thank you very much.
Yeah. No, my, I suppose, take-home message is that men, if you have any symptoms compatible with low testosterone level over the age of 40, 45, then go and get tested. and then get seen.
Well, I think that is a perfect note to end on. Thank you very much, and we will see you on the next one.
Thank you and goodbye.